In this video, I'm going to be walking you through our OBGYN H&P. And this is really designed for any situation, either outpatient or inpatient, your first initial counter, or in the ED setting. And the reason why I mentioned that is that it's really just going to be the very first initial counter because it only has the H&P portion of things. It does not have the progress or SOAP note template that subsequently follows. So it's going to look overall fairly similar to other notebooks that we have, but there's going to be some important key details when you're dealing with some type of, on your OB/GYN rotation, you're going to have different questions that you may be focused on. It's going to be a much more tailored exam. You're going to want to know globally what's going on, but also making sure that you don't forget very important questions. And so I'll kind of outline some of those in just a second. Here in your chief complaint, you'll see right off the bat, just reminders for things like your last menstrual period, the gravida pair of the patient, and overall, what's their chief complaint. Here, you're going to have a very similar section of your HPI review systems, social history, family history, and all of this is going to look fairly similar. The big difference is going to be in your gynecologic history, just giving you reminders in terms of what questions should you be asking in an OB/GYN type history. Things like your menses, when they had menarche, when the last menses they had, how long is their cycle or their duration of their cycle, what type of contraception they may or may not be using, what they've used in the past, any type of pregnancy or any type of pregnancy complications that they've had, any STD history, when was their last PAP, any type of abnormal PAP in the past, and then if they're in menopause, kind of some of the questions that you may be asking for menopause. So those are going to be your main questions in terms of, obviously there's much more questions that you can ask in the gynecologic history, but those are going to be the core ones that you cannot forget to ask. And then everything else is going to be fairly similar, but also some questions in your social history that are going to be a little bit different, and then also in your physical exam as well.
Be sure to check out our website, medicalbasics.com, for more educational resources like our progress notebook, and don't forget to subscribe to our channel for more tips and lessons.